if the final products do not change the status quo, and if they do not help to ensure collective security and equity, then we will have missed our chance to make history. This work is not easy, and it's occurring in a very difficult environment. The IMB and the IHR working group are operating amid a torrent of fake news, lies, and conspiracy theories. There are those who claim that the pandemic agreement and IHR will cede sovereignty to WHO and give the WHO Secretariat the power to impose lockdowns or vaccine mandates on countries. You know, this is fake news, lies, and conspiracy theories. You know, these claims are completely false. You know that the agreement will give WHO no such powers because you are writing it. We cannot allow this historic agreement, this milestone in global health, to be sabotaged by those who spread lies, either deliberately or unknowingly.
Yet another linguistic game compliments of the puppets at the World Health Organization. If the pandemic treaty is not to enforce global guidelines, then what exactly is it for? If it's not for ultimate control of sovereign nations, why would you even need one? One good takeaway from this clip is that Tedros and the World Health Organization have been hearing what we've been saying. That we question their quote-unquote authority, their so-called data, and their intentions for our future. Internist, cardiologist, epidemiologist, and the Chief Scientific Officer of the Wellness Company, Dr. Peter McCullough, joins us now with his response. Dr. McCullough, thanks so much for being with us today. It's great to see you again.
Thank you.
So, Dr. McCullough, what do you make of Tedros addressing citizens of the world who have been voicing concerns about this treaty? I mean, is this not the ultimate gaslighting here?
He didn't convince me. He didn't reassure you or your listeners, and he didn't reassure the world. This idea that, this isn't a power grab because, we're writing this as we go. The outline is there. We've read it. We don't like what we see. This is not a conspiracy theory. This is rational understanding, rational theory of what probably would happen if the Pandemic Treaty Alliance and the international health regulations go through. Many are advising, as I advised the European Parliament, pull out of the WHO.
Yeah, it's so critical. It's so important. So that's why I think they are doubling down on this narrative to try and get us to not proceed forward with what we are trying to accomplish here. It's just painfully obvious to me the WHO is planning to take over the world's guidance on healthcare while simultaneously stealing tax dollars of Western countries to achieve that goal. It's really sick, but really right out of the globalist playbook, if you will, to have us literally paying for our own demise, isn't it?
It's ironic and in many ways tragic if Western countries go along with this. WHO isn't elected. We don't have any way of providing oversight over the WHO. It's a one-way street, as you indicated. I personally don't trust them. As a doctor, I would never follow guidance from the WHO as an authority telling me what to do in my practice. And I couldn't imagine that whatever the WHO does would be enforceable by state or federal law in our country and any others.
Yeah, I can't imagine so either. What do you think their obsession is with a world of force and coercion? Why do they want this implemented so badly?
There are so many perceived global threats from their perspective. In my book, Courage to Face COVID-19, we call it biopharmaceutical complex. It's this working syndicate. And these threats stem from future infectious diseases, to a climate threat, to other threats that the population of either plants, animals, or humans faces. And so this idea that they could have global control to handle a worldwide threat. Well, honestly, one would have to work through each one of them. All of them have local or regional or national implications. Some of these threats, honestly, are debatable. We should have a very healthy debate whether or not any one of these is truly a threat to the world.
Yes, indeed. Well, we're so grateful for your voice in all of this. Thank you for speaking out against them and speaking up about the entire COVID narrative. I think a lot of people are still coming around to the truth, better late than never. And even Chris Cuomo is starting to see the truth as to what is really going on. I actually have a clip I want to play from News Nation, so let's roll that and then we'll come right back to you.
The reason the comparison to HIV is important is because HIV was also asymptomatic. I mean, you couldn't see the virus through symptoms because people were infected for 7, 8, 9 years before they developed symptoms. But HIV quietly destroyed our immune system, and we learned a lot about immunology from HIV, and it's changed completely our cancer therapy. We're learning now about mitochondria and viral impact and brain fog and the changes in our neurons and the cells that nourish our neurons that really allow us to think and move. And we're learning that because what of long COVID has done. And so there's two sides of this coin every time. There's a lot of destruction that mild and moderate COVID can do that is on scene, just like HIV was destroying our immune system. But what came out of that is brilliant science that changed how we treated HIV. And if you're diagnosed today, you can live a very normal lifespan, and people not only survive but thrive. We need to get to the place where people with long COVID, we've done the research so that people with long COVID can not only survive but thrive.
Wow. So we saw a lot of these two during the height of the scamdemic. And to be honest, I'm kind of shocked to see Cuomo covering this one. But what do you make of the doctor's comments here?
Boy, she's all over the map. You know, in HIV, there was a cancer of concern called Kaposi sarcoma, but HIV didn't revolutionize oncology. The Biden administration and HHS has spent $1 billion on long COVID. They haven't considered the vaccines as a problem, but even in long COVID, they've come up with nothing. No new drugs, no new protocols, and there she is, along with Biden and HHS, completely ignoring the vaccine. The vaccine caused much greater damage and destruction to the body, potential immunosuppression to the body than the virus does, and most of the people who took the vaccine got the virus anyway. And you know, there are now a handful of papers, both with the infection and the vaccine in both, where a small number of individuals turn HIV positive with COVID or the vaccine or both, and they don't have the HIV virus. It's actually a false positive, but it makes one wonder that there are parts of SARS-CoV-2 that have homology to HIV, and that's the reason why the blood test turned positive.
Very interesting. So would you say that COVID vaccines could perhaps be responsible for a future pandemic of AIDS-like symptoms here? I mean, is that the takeaway? Is that possible?
There is a terms of reference for the Australian inquiry. It's called vaccine-associated immunodeficiency syndrome. That in fact, maybe the glycoprotein that has this homology to HIV that is in the vaccine spike protein may be immunosuppressive. So it's possible that the vaccine and the high quantities of full-length spike protein are impairing the body's immunity.
Very concerning. Do you think the unvaccinated should be worried then as a result of the shedding in the spike proteins?
It's certainly possible. Again, the limited data on these false positive HIVs have occurred in COVID alone as well. So again, handful of studies both with the vaccine and with the illness. Immunosuppression is possible. You know, we've already had outbreaks of adenoviral hepatitis in children. We've seen reports regarding leprosy. There are some sources of evidence to suggest the pandemic, both the virus and the vaccine, have impaired globally immune systems.
Wow. Very alarming to say the least. On that note of the impaired immune systems, I wanted to get your take on this, Dr. McCullough. I saw this yesterday. I believe the term is called obelisks, correct me if I'm wrong, but apparently there is an entirely new class of life that's been found in the human digestive system. Is the COVID vaccine perhaps disturbing the gut biome here? Can you explain what's going on with this one?
It's hard to know. An obelisk is a shape like, like a memorial type of monument. But, the GI tract is clearly involved in COVID-19. That was actually one of my first papers early on in the pandemic published in Lancet on this. There have been endoscopy studies that have found the virus in the GI tract months after the original infection because we're always swallowing our oral pharyngeal secretions. That's how the virus gets down there. It's now well understood that the microbiome affects human health. So if the virus is actually down in the GI tract, disturbing life in the GI tract, other microbes, then that's going to affect health in some way. Some patients actually do have GI symptoms or symptoms that can be referenced to the GI tract. It offers an opportunity to try to improve the health of the oral pharyngeal and GI microbiome in order to get through long COVID.
Very interesting. Well, Dr. McCullough, thank you so much for breaking all of this down, and thank you for joining us today. We're so grateful for your time and appreciate all the great work that you're doing. Keep it up.
Thank you.
For all our viewers asking where One America News is heading in the future, we would like to introduce you to OAN Live. OAN Live is the best way to stay up to date on all of the hard-hitting, straight-shooting, national and international headlines. And the best part is, OAN Live is only $4.99 per month. All the credible, honest, unbiased reporting One America News offers at a fraction of the cost of cable. Just go to OANN.com to easily sign up for OAN Live and stay informed.